Patients trust clinical providers to deliver excellent care that is safe. So you may be surprised to learn that 10% of patients in America are hurt by the treatment they receive in hospitals. Healthcare must change. Learn more about Intermountain Healthcare's journey to zero harm and patient safety here on Healthy Dialogues. Because humans are prone to error, healthcare needs to put systems and processes in place and design the environment in such a way that it makes it easy to do the right thing and hard to do the wrong thing for patients. To understand this better, let's remember the experience of Dr. Ignaz Semmelweis, a European obstetrician practicing in the mid-1800s. Now, during Semmelweis's time, women were dying after childbirth from a condition known as childbed fever. Semmelweis searched for a cause, and he realized that it may have been at the mistake of physicians. You see, Semmelweis lived in a time before germ theory, and it wasn't uncommon for doctors to work on cadavers and then go immediately to deliver a baby without even washing their hands. Once he made this correlation, Semmelweis insisted that his entire staff wash their hands in a chlorine lime solution. Immediately, the mortality rate dropped. Now, this was revolutionary. But unfortunately, Semmelweis was the only one who thought so. The medical community rejected his hand hygiene process, and soon the mortality rate shot right back up. The lesson here is really very simple. Proven best practices work, but inconsistent adoption of these care standards puts patients in harm's way. In 2015, Intermountain Healthcare launched an effort called Continuous Improvement Zero Harm, a significant and lasting endeavor to ensure that every patient is safe in our care. We know that until every patient receives optimal care, we will continue to improve and strengthen our culture of safety. As Admiral Hyman Rickover once said, good ideas are not adopted automatically. They must be driven with courageous impatience. Once implemented, they can be easily overturned or subverted through apathy or lack of follow-up, so continuous effort is required. To help build a framework for our zero harm effort, Intermountain aligned with the company Healthcare Performance Improvement, or HPI for short. They're known for improving safety by applying principles from industries like nuclear power and aviation. These industries, like healthcare, operate under very trying conditions all of the time, yet unlike healthcare, manage to have very few accidents. The reason is they apply high reliability principles. High reliability principles include going upstream in any process to prevent behaviors that may ultimately lead to bad outcomes and implementing evidence-based leadership methods and best practice error prevention techniques to prevent errors that lead to harm. We are not alone in our endeavors to increase patient safety. Share what your organization is doing to improve patient safety in the comments below, and subscribe for more videos here on Healthy Dialogues.